the question was in the world of work. I would just talk about in the world first. Uh, if we look to the US, we're seeing data that shows a dramatic comfort with receiving kind of medications to your door, but care delivered virtually. And, it's somewhere between 15 and 20%. So, in Canada, the attitudes are a little bit different and we're a little bit slower on the uptake for sure. But I think what we're seeing as I don't want to call it an accelerant, but kind of an opportunity is as the comfort with that digital care piece takes hold, and we've kind of talked about that through this conversation, and the rising attitudes around just convenience and things on my terms and having them delivered to the home where I am working anyway, um, it starts to become a little more obvious. And then as you start to think about the opportunities for digital integration, where it's not just the pharmacy, it's the pharmacy tacked onto the virtual care. So, you're at the office or you're at home and you're, meeting with a nurse practitioner or a clinician, and there's an output from that. That output is a prescription. The experience on a digital level starts to become a little bit more additive and intuitive. And so we see, there's some opportunity there. And, when we look at other markets, we see that potential being realized. From our point of view, we also see they do a real great job of convenience and ease of use and helping to empower patients to really better understand their therapies. Today, if you ask most people what medications they're on, they probably don't know, or it's probably in a list in their wallet or purse. And to have that in kind of a more centralized location, have an opportunity to actually have control over that profile, and no more need to kind of have I don't want to call it an incoherent conversation, but a disconnected conversation with the doctor or pharmacist or nurse practitioner. When you're saying, they're asking what medications you're on, and it's like, I'm on a white oval pill that says 10 on it. Like, that's not ideal. And that's not ideal for healthcare. That's not ideal for a good conversation around health. So, we see this as, creating that experience that, once you have it, you're like, why didn't I always have this?
Jason, you mentioned that you think that people in the United States are ahead of people in Canada with using kind of telehealth. Do you think it's also generational that the younger?
I think there's a couple of things. I think one, it's, there's regulations that have supported it a little bit differently in the United States than in Canada. But I do think that we are seeing kind of niche players come out that really focus on kind of younger demographics, and, through birth control and erectile dysfunction and lifestyle type medications that are really, indexing toward that population. I think when we're looking at it, we're also seeing that, interestingly, on the kind of more, there's a sweet spot though, right, that we can play into. And so we're trying to say, how do we work within that for sure.